those dealing with CRPS or complex regional pain syndrome, what therapies, institutions, doctors, whatever it was, helped you best to achieve the lowest pain possible and even remission? All answers are welcome. Thanks. I'll share what helped me. So I got stem cell injections in 2014 in my neck, and it was for adhesive arachnoiditis. I used to have constant knife-like stabbing pain in my neck, and like it just put me down and it wouldn't go away. Like the only thing that stopped it, well, it took the edge off, was pain medications, and then I just had to lay down. And I mean, driving for like 15 minutes would cause it. So I got stem cell injections. What they did is they took my blood, they put it in a machine and separated the platelets and stem cells, and then re-injected the stem cells back in my neck. They put me in twilight for it, and they did like an x-ray machine to see where they were going in, and did it in 3 different areas of my neck. After 2 to 3 months, like I woke up and literally the pain in my neck like was basically gone. I mean, it still happens like if I overdo it or I do something stupid and like kind of re-injure my neck. But not only that, it helped with my complex regional pain syndromes. So like first few years with complex regional pain syndrome, besides this, I have it in my arms, face, head, and mouth area. And besides the swelling that I get in my hands and the discoloration, the ice cold to touch, and like feeling like molten burning lava on the inside, I had puking spurts, and they would be for days at a time, several times a day, projectile puke. It was really terrible. And then I also would get hives, and in fact I had one right here and I had one right there and over here. They're going away right now, but I had a really bad CRPS flare lately. But it like cut off the intensity of my flares, and like the puking and the hives, they only come out every so often now, whereas like every flare that it would occur. And I mean, I was having flares every few days sometimes, and they would last anywhere from a few days, weeks, months sometimes. I mean, it was out of control. Now, like, I mean, maybe every few months I'll get like the puking and the hives. I still get the swelling, but even that, like, my CRPS flares are less intense and they don't last as long. So I'm really excited to hear what has worked for you. Oh, also dieting, staying active. I know that's really hard to do, but like it's important to stay active and keep moving. At least for me, it is. Also, a combination of medications, which pain medications, muscle relaxers, and something to sleep with. That's what works best for me. And I realize everybody's different and we react differently, but that's what helps me.